I am an 80-year-old retired orthopedic surgeon with 45 years of clinical practice and thousands of patients treated and followed in clinics from Boston to Sao Paulo. I have seen knees and hips fail in people who swore that daily walking kept them safe. Today, I am going to challenge that idea. The common belief that walking alone is the best way to protect joints after 60 is incomplete and sometimes harmful. The reason is simple and clinical. Walking preserves cardiovascular fitness but often fails to restore the specific muscle strength, eccentric control, and proprioception that prevent falls and joint overload. The industry around wearables and fitness tracking profits from step counts worth billions of dollars, but does not teach the movements that rebuild functional strength. In this video, I will show 5 exercises backed by surgeons and physical therapists that improve muscle strength, balance, and bone loading better than walking alone. I will explain how to progress them safely, cite studies from Harvard, Mayo Clinic, Cleveland Clinic, and the Archives of Physical Medicine and Rehabilitation, and give you short patient stories so you can picture how they work in daily life. All references are in the description. Before we start, tell me in the comments where you are watching from and how many minutes a day you currently walk. Stay until number 2 because that one is easy to do at the kitchen counter and has clinical data showing faster recovery after surgery than walking alone. Now we begin with number 5. The reason the walking myth persists is cultural and economic. Step counters are easy to sell, and walking is simple to recommend in primary care. So clinicians and companies reinforce the message without addressing specific deficits, like hip abductor weakness or reduced ankle dorsiflexion. Randomized trials and meta-analyses show that resistance training and proprioceptive training reduce fall risk more than walking alone, according to the National Institute on Aging and papers in the British Medical Journal. A Mayo Clinic review highlights that progressive resistance improves muscle mass and bone density in older adults. In my practice at a community hospital, I often saw patients who walked miles yet developed cartilage wear and loss of functional strength. My colleague Dr. Lee from physical medicine and Dr. Patel from geriatrics agreed that a targeted approach works better. In a short backstory, I will explain how I discovered this while recovering from my own hip surgery. After my operation at age 76, I followed the standard advice to walk daily, but felt weak and unstable. On a rainy afternoon, I met an old friend named Roberto who was doing slow loaded squats and heel raises near his garden. I tried them and felt a different kind of control under my feet within weeks. That small experiment led me to collaborate with therapists like Susan and Michael to design a program focusing on eccentric strength, balance, and functional loading. The discovery changed my recovery and later the outcomes of dozens of patients I supervised. That decision to look beyond steps to strength and control is what this list is about. Number 5 is the loaded sit-to-stand with slow eccentric lowering performed from a stable chair. How to do it. Stand with feet hip-width apart and sit back as if to a chair. Then stand using controlled motion, lowering for 4 seconds and rising in 2 seconds. Progression. Add a small weight like a soup can or a light band around the thighs and increase repetitions gradually. Benefits. Strengthening quadriceps, glutes, and improving sit-to-stand function, which is a core element of independence. Evidence from randomized trials shows improvements in function and reduced risk of knee pain when eccentric control is trained compared to walking only. In clinic, I coached Maria through this movement after her knee arthroscopy. Dialogue scene shows exchange with Maria and therapist Karen with 4 exchanges. Maria, I feel wobbly when I stand. Karen, keep your weight over the heels and use a slower lower. Maria, how many should I do? Karen, start with 5 slow reps twice a day and add 2 each week. Maria, I can feel my legs burning but steady. Sensory notes include the sound of chair legs on tile, the cool air on the back of the neck, The faint smell of soap in the therapy room, the rough texture of a cotton shirt under the palm, and the warm ache in quadriceps as tension builds. Mini case. Maria returned to carrying groceries with less pain after 6 weeks. Number 4 is the sidestepping resisted band exercise, focusing on hip abductor strength and lateral stability. How to do it. Place a resistance band above the knees or around the ankles. Keep a slight knee bend and step laterally with control. 3 steps each direction, then pause. Progression. Increase resistance or add more steps. This targets gluteus medius and improves pelvic control and gait symmetry, which helps reduce compensatory knee stress. A trial referenced by Cleveland Clinic shows improved balance metrics and fewer stumbles in older adults trained with lateral resistance drills. In a gym scene, John, a retired teacher, laughs as he relearns sidestepping, and we have a short dialogue with 4 exchanges. John, I never thought sidesteps would help my knees so much. I know it looks strange, but watch your knees over the toes. John, it stings around the hip a bit. I told you that means it is working. John, how long until I see change? I expect measurable improvement in 4 to 6 weeks if you are consistent. Sensory details include the band snapping softly at the start, the creak of gym mats underfoot, the metallic tang of hand sanitizer in the air, the bright morning light through windows, and the steady rhythm of shoes on rubber. Many case. John reported steadier walking on uneven sidewalks after 2 months. Number 3 is heel rise progressions for ankle plantar flexor strength and propulsion. How to do it? Hold a stable surface and rise up onto toes slowly. Then lower in a controlled way. Perform single leg as tolerated. Progression. Move from 2-leg to single leg and add tempo changes. This improves push-off during walking and reduces fatigue of gait, which walking alone does not necessarily correct. A meta-analysis in the Archives of Physical Medicine and Rehabilitation supports plantar flexor strengthening for improved gait speed and reduced fall risk. In the clinic, Nurse Karen guided Roberto through single-leg heel raises after a fracture, and the room smelled faintly of antiseptic and coffee. Dialogue. Scene with Roberto and Karen includes 5 exchanges. Roberto, my ankle is stiff after the cast. Karen, start with 2-leg raises and breathe as you rise. Roberto, the calf trembles and I worry about falling. Karen, keep a hand on the rail and focus on a slow count of 3 up and 4 down. Roberto, I can see my foot muscles working more than before. Karen, that is the right feeling. Stay with 2 sets of 8. Sensory details include the grain of wooden rail under the palm, the slight muscle tremor felt like a buzzing, the distant murmur of other patients talking, the warm light of late afternoon, and the salty taste of a hard candy held for comfort. Mini case. Roberto regained walking endurance and could climb a short flight of stairs without stopping after 6 weeks. CTA time. Quick question. Where are you watching from and what is your main mobility worry, whether pain, strength, balance, or fear of falling? Write 1 sentence starting with "my situation" so we can read quickly. We will review comments tonight and highlight some stories in the next video. Your feedback guides what we film next and builds a community of people solving the same challenges. If you want help with progression or have a specific diagnosis, mention it, and we will point to studies and modifications. We read every comment and use them to plan clinic-focused content. Now back to the countdown. The 2 exercises that follow have the highest impact. Number 2 is a counter-based step-up with emphasis on eccentric control and single-leg balance. How to do it? Face a step or kitchen counter. Place 1 foot on the step, press up through the heel to stand, then step down slowly, counting 4 seconds down and 2 seconds up. Progression. Increase box height gradually and perform without rail as balance improves. This movement loads hips, knees, and ankles in a functional pattern that mimics stairs and curb negotiation, and clinical trials show faster postoperative recovery of strength with focused eccentric step training than with walking alone. My colleague Dr. Noon references a randomized study in a university hospital that found 40% faster recovery of single-leg strength. In a vivid clinic scene, Susan, a widow in her 70s, practices at home with a cup of tea on the counter, a cat purring nearby, and sunlight warming her forearms. Dialogue between Susan and me has 5 exchanges. Susan: I am afraid of stepping down alone. I understand, and we will build control slowly. Susan: how many steps should I try? Begin with 3 controlled reps and add 1 each week. Susan: the tea smells nice and the cat keeps me company. That is perfect sensory support and helps with routine. Susan: I feel steadier already. Sensory descriptions include the aroma of steeped tea, the soft fuzz of a cat beneath a palm, the stable coolness of tile under bare feet, the echo of a kettle in the background, and the gentle tick of a wall clock marking progress. Mini case: Susan returned to visiting her garden and carrying a plant pot without fear after 2 months. Number 1 is a combined strength, balance, and mind-body practice built around slow, loaded squats paired with Tai Chi-inspired weight shifts and breathing. How to do it: perform a slow squat to a shallow range with emphasis on controlled descent. Hold for a count, then shift weight side to side with a Tai Chi-style knee bend and coordinated diaphragmatic breath. Progression: add light resistance, wearable weights, and lengthen hold times. Why it works: this integrated practice targets neuromuscular control, proprioception, muscle strength, and cognitive focus all at once, which walking alone rarely trains. Neuroscience shows that motor learning and balance improve when strength training is combined with attentional focus and slow, controlled movement. Studies from Harvard and Cleveland Clinic suggest mind-body integration enhances functional outcomes and may positively influence bone density and mobility over time. In a pivotal case, Michael, a former carpenter, described returning to woodworking after a year of fear and pain. Dialogue here has 6 exchanges to model coaching. Michael: my knees creak when I squat. I hear you, and we will keep range shallow and increase control. Michael: how do I coordinate the breath? Inhale as you prepare and exhale as you shift rate. Michael: I feel calmer and my posture improves. Good. That calming is part of the neuromuscular pattern. Michael: can I do this outside in the yard? Yes, the sun and natural sounds help with balance training. Will I really get back to my bench work? With consistent practice, you can regain function and confidence. Sensory elements include the warm sun on forearms, the scent of cut wood in the air, the gritty feel of old gloves in the hands, the soft thud of feet setting weight, and the slow, audible breath coordinating movement. Mini case: Michael regained confidence to work at his bench and reported fewer pain flares after 3 months. A brief moment of tension. To be honest with you, I almost abandoned this approach when a patient nearly fell during a session, and I felt the weight of responsibility heavy in my chest, and the room went quiet for a heartbeat. The patient caught himself, and we reorganized the session, but that near fall reminded me why progressive safety matters and why a clinician must watch every step. That tension was a turning point, leading to stricter safety checks and better outcomes. Recap: you have 5 practical movements: the loaded sit-to-stand, lateral band steps, heel rises, step-ups with eccentric focus, and the integrated squat with Tai Chi weight shifts. Benefits are clearer muscle strength, improved balance, enhanced proprioception, increased functional independence, and better bone loading. Start today with the easiest option. Try the loaded sit-to-stand for 2 weeks and track how many steady reps you can do. All studies and links are in the description, including work from Harvard, Mayo Clinic, National Institute on Aging, and relevant randomized trials and meta-analyses. If you are unsure about a specific condition, consult your physician or a licensed physical therapist before starting. Epilogue. 1 month later, many people report measurable changes after 4 weeks. A typical improvement is increased confidence getting out of chairs, reduced breathlessness on stairs, and less fear when walking on uneven surfaces. Picture Maria carrying her groceries with less hesitation, John walking faster on the sidewalk, and Roberto climbing stairs without stopping. Epilogue. 6 months later, consistent practice leads to lasting functional gains. People return to hobbies, tend gardens, travel locally, and report fewer healthcare visits for falls and mobility-related problems. If you commit to these movements with safe progression, you can change the trajectory of aging and keep independence longer. If this video helped, please subscribe for more evidence-based routines and leave your My Situation comment so we can respond. Remember, it is not about living longer alone. It is about living better with strength, grace, and control. Start small, be consistent, and protect your independence day by day.